Hello students, welcome to my class. So in this video we will be starting with unit 3 under which we will be discussing about metal ion in the body, what is the reason for their deficiency, how can it be treated, how metal ions can be toxic and how toxicity can be removed by chelation therapy, etc. etc. So we'll begin with the disease due to metal ion deficiency and how that disease can be treated. We'll be studying some metal ions in particular. To begin with, the potassium, you know that potassium, we obtain potassium in our body through the food that we consume and it acts as an electrolyte. Potassium, as we studied earlier, is also involved in the sodium potassium pump in the body, and it is very important in our body for different functions such as maintaining blood pressure, water balance, muscle contraction, nerve impulse, digestion, pH balance, heart rhythm, etc. Okay. So, consuming very little of potassium also can be a very can lead to some serious health issues. Or if you take too much also, so anything that is very less or very less is very more is harmful to you. Correct. So you should take the optimum amount that is required for your body. So, where is this optimum level of potassium maintained is in your kidneys. So, if your kidneys are healthy, they maintain normal potassium level in the body. Because if it's excess in your body, what will the kidney do? It will remove the excess amount through urine. That is a function of kidney, right? To remove all the waste from the body. So if we have excess of potassium in our body, that is removed by the kidney through urine. If we have less amount of potassium, then the kidney will discard only little amount from our body so that it can maintain the required amount in the body. Okay, that is only if your kidneys are functioning really well. Next, what are the conditions or why do we get this potassium deficiency? The potassium deficiency, it is also called as hypokalemia. So this is because of either kidney diseases. If you have any kidney disease, kidney related any problem, so you might also end up getting potassium deficiency because we studied correct that kidney is the one that can maintain proper potassium balance in your body. But if the kidneys are not proper, you might end up getting potassium deficiency, or maybe because of overuse of diuretics, that is they are a form of drugs that is usually consumed. They are also called as water pills. They're also consumed for a removal of excess of sodium from your body usually. So they're a form of drug. But if we over consume that kind of drug, any drug for that matter, it can affect other body functions. So this is one of the reason, or maybe because of excessive sweating, because when you sweat, obviously it's not just water but some minerals as well as they are going out of your body. So potassium also can be lost in that way, or because of diarrhea, vomiting, or because of magnesium deficiency also, or use of some antibiotics like carbapenicin or penicillin. Okay. So, what are the symptoms of hypokalemia? So, this is not a very big disease initially. If it is present in, if you have little deficiency, it can be overcome. But if this deficiency continues for a prolonged time, then it can be something, it can turn into something serious. So, a temporary decrease in potassium, it won't show much symptoms. For example, like if you have been working a lot throughout the day, so doing some hard work, then you would definitely sweat a lot. But you can, that time you're losing a lot of potassium from your body, but you can bring back that level by eating like a proper healthy meal or consuming some electrolyte. So there will be no damage done at that time. But if your continuous diet does not include proper mineral, if you're continuously eating junk and not the required amount of minerals, then it can lead to deficiency, which can, give you problems like fatigue. That is, there is loss of energy. You cannot work, and muscle spasms, weakness or cramping, irregular heartbeat, nausea, vomiting, and constipation, etc. So, how is this diagnosed that you have a deficiency of potassium? Is through blood test they can make out. And what is the treatment that is done in order to treat potassium deficiency is, first of all, they give you potassium supplements, that is they are in the form of pills that are taken in order to uh, bring your potassium level back in the body. So only if your kidneys are good in functioning, then these supplements are effective. So if your case is very severe, then the patient might require IV treatment, that is in lab the treatment is being done because there is heavy deficiency of potassium in the body. And potassium sparing diuretics that can get rid of excess sodium. So a balance between sodium and potassium is maintained in our body, correct? So if you have less potassium and excess sodium, that will lead to an imbalance. So some diuretics can be consumed so that you get rid of that excess sodium that you have. This can manage their normalize, bring back this electrolyte level in your body, bring a balance in it. But these diuretics, they have their own drawbacks, or they are harmful to the body in different ways, that is they can harm your digestive tract, etc. So mostly preferred type is consuming proper food that has potassium in it, and also if the case is severe, then taking some supplements. Next is magnesium. It is also one of the essential minerals for our body. You know that they play a very important role in your bones. So, due to deficiency of magnesium, definitely your bones will not grow strong enough. And some amount of magnesium also found in the blood. So, what are the symptoms of low magnesium in your body? Is nausea, vomiting, and you'll have weakness and not a proper appetite. Your appetite will go down. So if the deficiency is like lot, extreme conditions can lead to muscle cramps, numbness, tingling, seizures is nothing but it is a burst of uncontrolled electric activity between the brain cells. So it can lead to temporary numbness of your hands, bones, and muscles. And it can you might not be able to walk or use a particular organ, use a particular part of the body like hands or legs because of sudden seizures. And also it can lead to abnormal heart rhythms. So why is this low magnesium caused is because of decreased absorption of magnesium in the gut, or increased excretion of magnesium in the urine. So whenever you're consuming a certain amount of food, that minerals from that food is absorbed, especially in your intestine. But if it's not absorbed efficiently, this can lead to decreased problems related to decreased amount of magnesium. Or if excess of magnesium is thrown out of the body in the kidneys through your urine, that also can cause you problem. So low magnesium levels in otherwise healthy person, they are uncommon, because it is not seen a lot in healthy person's body. This is because magnesium level, also like potassium, most of the minerals, their level is controlled by the kidneys that are there. So this kidney will manage. If the magnesium level is little less, then there will be a decreased excretion from the body of, or if it is little excess, then more excretion will be there. But if the person's, as I said previously, if the person's kidney itself is not working properly, then it can cause major problems. So continuously low dietary intake of magnesium can lead to excessive loss of magnesium, or presence of hyper conditions, that is the hypomagnesemia. Hypomagnesemia is a condition where you have very like low level of magnesium in a body. So it is not common in a lot of people because usually our diet includes dairy like milk, yeah, butter, etc., etc. So somehow we'll be nuts, etc. So we'll be consuming magnesium ions through some way through all these, food items. But in some of the patients who are already hospitalized maybe due to different diseases, they might, like, they might be having an illness or undergoing a surgery, or they will be in certain type of medication. Such people can suffer from low magnesium content. Okay. And conditions that increase the risk of magnesium deficiency include gastrointestinal diseases, or the person who has type 2 diabetes can also suffer from magnesium deficiency because of higher concentration of blood glucose level in diabetes, the patient will be secreting more urine. Because the patient is secreting more urine, more of magnesium content is lost from the body. Okay. So because of this can also lead to magnesium deficiency. And if a person is going through chemotherapies or is alcoholic, or you also is use of loop diuretics, that is in some kind of drug, so that person may also get low magnesium in his body. So what are the methods to treat hypermagnesia? It is, once again, there is oral intake of drugs or magnesium supplements to increase magnesium content. And other thing is consuming of magnesium rich food like spinach, almond, cashews, and more like milk and other dairy products also, as well as in severe cases it may lead to seizure, which can also lead to death, or like a paralysis case where one part of your body can forever stop working. So that person can actually undergo in some kind of intravenous surgery wherein magnesium will be given to him as through his veins. So that can help in bringing back the magnesium level in the body. Next, we are studying about selenium. Selenium is one of the important mineral, and it is required for many processes such as thyroid hormone metabolism, DNA synthesis, especially in reproduction and protection of body from various infection. And selenium deficiency is because of not enough selenium present in the body. And majorly this selenium amount of selenium in food source, it is determined by how much selenium is present in the soil in which that particular food, that is maybe that particular vegetable, is grown. Okay. If that particular soil in which that vegetable is grown does not have enough selenium in it, so the food content will also lack selenium, and hence the person consuming that particular food will not get enough selenium to meet all the selenium requirements in his body. So one of the disease that is caused by selenium deficiency is called as a Keshan disease. It is a disease that is related to selenium deficiency, and it is seen in the endemic regions of China. And because of this, there's a lot of heart related problems like cardiomegaly or heart failures are all caused because of deficiency of selenium, that is because of the Keshan disease. And this disease is usually triggered by some chemical trigger, or whenever if a person is infected by Coxsackie virus, then that person may also get Keshan disease. It's triggered by these two things. And selenium deficiency, the person can show symptoms like infertility and muscle weakness, fatigue, hair loss, etc. And it is very difficult to diagnose this particular disease, but In some cases, you can measure the level of a particular enzyme that is called as a glutathione peroxidase. This is an enzyme that requires selenium to function. So, in order for that enzyme to get activated, it requires selenium. So, indirectly, by measuring the amount of this enzyme, activated form of this enzyme present in the body, you can understand how much of selenium is present in the body. Next, what is caused if what are the treatments that are to be done if the person is suffering from selenium deficiency? First thing is to consume selenium rich food like nuts, yellowfin tuna, rice, beans, and whole wheat bread. And then there are certain selenium supplements also, like in the form of drugs or tablets. These are like multivitamins that contain selenium, and some of them they are in the form of selenomethionine or selenite. So this selenomethionine, it tends to be easier to your body to absorb, and it can treat severe deficiency of selenium. This is about humans. Then, in case of cattle, like in case of rats, if this causes selenium deficiency, it causes liver necrosis. And in case of this cattle, sheep, rabbits, selenium deficiency can result in change in the muscle cell membrane. This can ultimately it can lead to dying of your muscle cells, and usually because of that the animal can also suffer death. So the sheep's grown in the land that is deficient of selenium, they suffer from a disease that is called as white muscle disease. Next is calcium. Calcium is also another important mineral that is required for your strong bones and teeth. And also, it is required for your heart and muscles to function properly. And because of calcium deficiency, there can be several disorders like osteoporosis, osteopenia, and hypocalcemia. Hypocalcemia is a situation where the body is suffering from deficiency of calcium. And during the growth ages, if the children they do not get enough calcium, they can, they will not grow into fully grown adults. They can face growth deficiencies because of less calcium present in their body. And many people are at the increased risk for calcium deficiency as they age, because once you start growing old as well, a person can face calcium deficiency. This is because of various factors such as poor calcium intake, or over a long period, especially when you're a child. If you are not taking proper, like milk or other calcium related products, that can lead to unhealthy body as well as improper growth and development. And also, if you're taking some other medication, that can lead to decreased absorption of calcium and intolerance to food rich in calcium. That is, some people they are lactose intolerant, meaning to say they cannot consume products like milk or milk related products which actually have calcium in them. So, such intolerance or even hormonal changes that's seen in women, or even certain genetic factors. Next, what is the symptoms that is seen because of calcium deficiency are like muscle spasms, numbness, memory loss, depression, hallucination, muscle cramps, and brittle nails. In extreme cases, they can also lead to, fracturing of bones and seizure. And calcium efficiency sorry deficiency, that affects your nails as well as your hair, especially, because they contain that calcium mineral in them, so leading to their weak growth. So, calcium deficiency, it can be usually overcome by consuming some kind of food that is rich in calcium, or also a person can consume supplements like calcium carbonate, phosphates, or different. Nowadays you get a lot of supplements in the form of tablets or syrup, or chewable. Next is the deficiency of sodium. So, such a condition where the patient is suffering from sodium deficiency is called as hyponatremia, and it is because of the concentration of sodium in the blood is abnormally low. So, why is sodium required? It acts as an electrolyte. It is required in sodium potassium pulp, and it helps to regulate the amount of water that is in and around your cell. So in this case, that is hyponatremia. It's a medical condition. It may be caused by because of drinking a lot of water, because of which the sodium that is present in your body will get extremely diluted, and this high level of water goes to get filled in the cell. So, because sodium cannot maintain that electrolyte balance or balance of water in the cell, because of which cell starts to swell up, and this can lead to severe other problems. So, why is it caused? Majorly, one is sodium deficiency, or if you are caused whenever you're not consuming enough sodium in your diet, or if you're consuming too much of water, it can lead to dilution of sodium in your body. Okay, so if the what are the symptoms that are caused, like nausea, vomiting, headache, loss of energy, fatigue or muscle weakness, seizure, coma, etc. Coma in case of extreme conditions. This can be treated in different ways. One is if your sodium deficiency hasn't reached like uh, to the peak, and if it's like in a controllable condition, then your doctor may suggest you to cut down the amount of fluid that you're consuming and reduce the amount of water that you're drinking. But if it has reached to an excess condition, then there might be two other option, that is intravenous fluid, that is in hospitals where sodium solution is given uh, through you through like syringe through intravenally, and to bring back the sodium level in the body, and this might also require the patient to be in the hospital for few days wherein they can keep monitoring the sodium level. Also medication would be suggested, that is certain pills that can get back the sodium level in your body. Next is iron. Iron deficiency. It leads to the condition called as anemia, majorly because you know that iron is the main metal ion that is present in your hemoglobin as well as myoglobin as a central metal ion. So if there is iron deficiency, that porphyrin ring will not have this iron in it, because of which hemoglobin cannot function properly. So that entire oxygen storage and transport process will not take place efficiently in your body because you have iron deficiency. So iron deficiency, it leads to the condition called as anemia. So what is the treatment for this is one is Fe. In Fe deficiency, you can consume certain pills like FeSO4, that is coated with fructose or lactose. This coating is there in order to protect it from aerial oxidation. That is, when it is getting into your body, aerial oxidation should not take place. So it is being coated with fructose or lactose, or different pills of ferrous fumarate or ferrous glutamate, etc. They are recommended in order to bring back the iron level in the blood. Next is zinc. Zinc deficiency, it leads to different problems like growth retardation, dwarfism, or the person may not have sexual maturity, improper development of the gonads or reproductive parts, or loss of body hair, poor appetite, and skin problems. And also, zinc is one very important mineral that is required for wound healing. So the person with zinc deficiency will not show proper, will show delayed wound healing if that person gets wound by any chance. And also, if the pregnant woman does not have enough zinc in the body, that offspring that is born will not have proper functioning body, so malformation can take place. And mostly 30% of the zinc, it exists in the skin and the bones. But if the person is affected by zinc deficiency, it can suffer from skin and bone problems. Okay. And also this zinc is very very important in functioning of different enzymes. So if it's not in enough content in the body, it can affect the functioning of different enzymes like alkaline phosphate, carboxypeptidase, thymidine kinase, and DNA polymerase. So most of the enzymes might not work properly in the body. So overall the body functioning will not take place properly. So how can zinc deficiency be treated? That is, there is clinically available zinc sulfate capsules that are to be consumed in order to treat the zinc deficiency. Next is manganese. Manganese deficiency can also lead to retarded growth, skeletal abnormality, and hypocholesteremia, or different problems in the reproductive parts, reproductive failure, and also in the offsprings that are born can suffer from impaired growth of organs. So, in glycoprotein synthesis, the manganese, it plays manganese dependent enzyme like glycosol transferase, glycosol transferases. They play a very important role in glycoprotein synthesis. Okay, so if this enzyme is not there, then the glycoprotein synthesis process will not take place properly, because of which it can lead to skeletal abnormalities and aesthesia. Okay, that is improper development of different bones and organs. So, how is manganese deficiency treated? It's clinically treated by taking pills that have MnSO4 content in them. The last one is we already studied this, that copper deficiency can cause a major disease, that is Mink's disease, that is growth of white hair in the body, which indicates that there is deficiency of copper in the body. And also, there are several other copper dependent enzymes in the body that cannot function if there is enough copper present in our body. So what is the way to treat copper deficiency or Ming's disease? One is through different food supplements that contain copper, or also due to you can also, there is a therapeutic agent, that is copper histidine, that is administered into the body, or sent into the body, that can increase the copper uptake in the body. So this was about different metal ions and how their deficiency can be treated. In the coming videos, we will be discussing further about this topic. So with this, I end this video. Thank you for attending my class. Bye.